my name is Ziad, I'm one of the doctors here on the ward. Can I just get your name and date of birth, please?
Louis Jones, 19th of January 2001.
Okay, and how do you like to be called?
Just Louis.
Brilliant. And how old does that make you, Lewis?
40 years.
Brilliant. Okay, so today what I'm going to do is just have a look at your chest and listen to your heart, if that's okay?
Yeah.
So I'm just going to take a look around the bed and see if you've got anything.
Have an obvious look around the bed for any indicators of cardiovascular disease.
Okay, can I just get you to take your top off for me? Just take a look at you generally.
Examine the child from the end of the bed. Look for signs of their nutritional status, any scarring or deformities, their level of respiratory effort, any cyanosis, and any obvious dysmorphic syndromes such as Down syndrome.
Okay, can I just get some hands first?
Look in the hands for signs of peripheral cyanosis, splinter hemorrhages, clubbing, and check the child's capillary refill. If you're feeling confident, the following technique can make clubbing easier to see.
Okay, if you just point your fingers up and then just do this one and just check it.
In a child, clubbing is indicative of a chronic suppurative lung disease like cystic fibrosis or a cyanotic congenital heart disease. It is also sometimes seen in inflammatory bowel disease. Assess the rate, rhythm, character and volume of the radial pulse. Remember that the normal heart rates for children differ by age. Although knowing the rates for each category is useful, you are most likely to encounter the last two in an OSCE scenario. Check for radio-radial delay and remember to offer to check for radio-femoral delay and to take the child's blood pressure.
Okay, so just moving on up to the face now. Can I get you to just put your hands for me there?
Look for pallor and jaundice sclera. Pallor could indicate anemia and jaundice could indicate congestive cardiac failure with hepatic congestion. Look for mitral flush in the cheeks, indicative of the increased hematocrit that accompanies cyanotic heart disease. Check for central cyanosis, dental caries, and a high arch palate indicative of Marfan's.
Okay, you can let go of them now. And you just open your mouth wide up, open for me. Say ah,
Ah.
and then stick your tongue out at it, and to the roof. Okay, that's fine. So I'm just going to feel the pulse in the neck.
Feel for both carotid pulses and assess their volume and character. Checking the JVP is rarely useful in children.
Okay, so next I'm just going to take a look at your chest. So if you just do this for me.
Look more closely at the chest to assess for any obvious scars, the names of which you should be aware of, any visible pulsations, and any deformities or asymmetries. Also make note of the child's respiratory rate.
So I'm just going to feel for your heart.
Note the location of the apex beat. Is it displaced? Also note its character. Is it overly forceful or thrusting? Now feel for a left parasternal heave, indicative of right ventricular hypertrophy, as well as thrills along the sternal edges and in the suprasternal notch.
Right, so what I'm going to do now is just listen into your heart. There's 4 areas we like to listen into.
Auscultate over all 4 valves, beginning at the apex with the bell and moving into the axilla. Auscultate over the neck to assess for aortic stenosis, and below the clavicle to assess for a PDA. Be sure to know the timings and locations of the common murmurs.
Okay, if you just put your hands on you. Okay, it's just roll over. Okay, that's fine. So next what I'm going to do is just, while listening to your heart, just get you to do a few moves with me. So if you just lift your hands up like that. If you sit forward for me, take a big breath in and out. Okay, that's fine. If I get you to big breath in and just hold it, and then out. Right, I'm fine. I'm just going to
Auscultate in the interscapular region for coarctation of the aorta, and to the lung bases for the inspiratory crepitations indicative of cardiac failure.
just going to pinch your valve and just see if there's any swelling. Okay. You just lie down for me. And last one, I'm going to just see if there's any swelling. Just press down. So to conclude my examination, I'd like to check for hepatomegaly, get a set of observations, plot his weight and height on a growth chart, and do a full respiratory and abdominal exam.